Okay, let's unpack this. What if an ancient scourge, the kind responsible for wiping out millions throughout history, were suddenly repurposed, like as a modern threat? That's the, well, chilling but vital topic of our deep dive today. We're sifting through a consensus statement from a working group of top experts. We're talking medicine, public health, emergency management. Our mission, really distill their crucial insights on plague as a biological weapon. It's actually a topic the CDC lists as a critical biological agent.
Yeah, and what's fascinating here is how these experts synthesize, decades of research to create this actionable playbook for civilian biodefense. It really makes you wonder, how would our world truly respond to something like this, such a unique challenge? And, what are the absolute essential facts you need to know?
And here's where the history gets, well, pretty stark. This isn't just some abstract theory. Our source details the devastating past of plague, right? From the first recorded pandemic back in AD 541, huge populations wiped out, right through the Black Death in the 1300s, which claimed, what, up to a third of Europe? Massive. And it even points to more recent history, like Japan's Unit 731, which chillingly dropped plague-infected fleas over parts of China in World War II.
And if we connect that to the bigger picture, the modern concern isn't just history repeating itself. It's the capacity for mass production and aerosol spread. The report highlights this 1970 WHO scenario. Just 50 kilograms of Yersinia pestis, that's the plague bacterium released as an aerosol over a city of 5 million, they estimated it could cause 150,000 cases of pneumonic plague and maybe 36,000 deaths. Yeah. And the aerosol itself could remain viable for up to an hour, spreading maybe 10 kilometers. And, while the U.S. offensive bioweapons program was officially terminated, Soviet scientists reportedly manufactured massive quantities. We even had that case in Ohio, 1995, a microbiologist arrested for fraudulently getting Y. pestis by mail. It's definitely a concern.
That WHO scenario is just terrifying.
Yeah.
But, okay, given that history and that potential devastation, how would an actual bioweapon attack using plague differ from, say, natural outbreaks? That feels like a really critical distinction.
It absolutely is. Most naturally acquired cases, they're bubonic plague, usually from flea bites, right?
Yeah.
And crucially, they don't spread directly person to person easily. But an intentional attack, that would most likely involve an aerosol release.
Yeah.
And that leads directly to primary pneumonic plague in anyone exposed.
Okay, primary pneumonic plague. So if that's the case, what's the immediate impact? If someone's exposed to this aerosolized form, what would they actually experience?
Well, symptoms like fever, cough, chest pain, sometimes even coughing up blood or watery sputum, they'd appear pretty quickly, usually 1 to 6 days after exposure, but often just 2 to 4 days. And here's a critical point, almost counterintuitive. This kind of bioweapon attack might not present with those classic buboes, the swollen lymph nodes we associate with plague.
Really? No buboes?
Right. Their absence is actually a key differentiator in this scenario. The disease would progress incredibly fast, leading to septic shock and very high mortality in just 2 to 4 days if it's left untreated.
Given that plague is pretty rare in many places now, I imagine the first few cases could easily be missed, maybe look like just severe pneumonia. It sounds like early detection is a huge challenge.
Yeah. You've hit on a crucial point. The experts highlight this kind of frightening gap. We currently lack effective environmental warning systems, and there aren't widely available rapid diagnostic tests for plague either. So yeah, a sudden, fast outbreak of severe pneumonia in previously healthy people, especially if they're coughing up blood, that should immediately raise suspicion, but often the first real sign of an attack might just be widespread severe illness already happening.
Okay, so if early detection is tough, then rapid action becomes absolutely critical for survival. The experts really stress immediate treatment based just on clinical suspicion, right?
Yeah.
Without waiting for lab tests.
Exactly. Because delaying therapy for even 24 hours drastically decreases survival rates. It's that serious. The consensus recommends potent antibiotics given by injection like streptomycin or gentamicin, ideally in a contained hospital setting. But for a mass casualty situation or for protecting people after exposure before they get sick, oral doxycycline or ciprofloxacin are preferred. They're just easier to get out to lots of people quickly.
Makes sense. And what about containing the spread once it is identified? What kind of infection control are we talking about?
For infection control, the recommendation is respiratory droplet precautions. So surgical masks for close contacts, because person-to-person transmission happens via those larger respiratory droplets. But what's interesting, this analysis also notes that large-scale environmental decontamination isn't necessary.
Oh, why is that?
Well, Y. pestis, the bacteria, it doesn't form spores like anthrax does. and it actually doesn't survive very long outside a host. It's quite sensitive to sunlight and heat.
Right, okay. So you've now got a pretty deep dive into this complex and, let's face it, sobering world of plague as a potential biological weapon. It's definitely a topic where understanding the specifics really helps us appreciate the incredible work these scientists and medical experts are doing to prepare.
Absolutely. And this brings us to a crucial question for you, the listener, to think about. In this age of rapid information, global connectivity, what role do we all play, in being prepared and critically informed about these kinds of potential public health challenges? And perhaps what kind of research, maybe better diagnostics, more accessible treatments might still be needed to truly safeguard against this ancient threat potentially reemerging in a new, terrifying way?